Are you looking to have a minimally invasive surgery, especially for your back, for spinal stenosis in particular?
Mm-hmm.
Let me tell you all about my minimally invasive procedure. Welcome to my channel. If you like it, please hit the subscribe button or the like button, whichever one, and leave a comment below. So let's get into it. This minimal invasive surgery is called a laminectomy. A laminectomy is where they provide space inside of the spinal canal. It's called decompression. What they're going to do is take all of the pressure that is around your nerves, clean it out, get all of the stuff that spilled over and everything. They're gonna just clear all of that out. Pretty much allow you to be able to walk again like normal, like as if nothing ever happened. Did that happen in my experience? Yes, it did. And I felt great. Let's talk about the things that they didn't say. Yes, it's minimally invasive, but for my minimally invasive surgery, I actually had to stay in the hospital. Now, this could have just been for me. I was anemic. I'm no longer anemic, but I was at the time of that surgery. So they had me stay in the hospital until I absolutely recovered from the blood loss. In actuality, I was supposed to go back home the same day. This is what's really funny is that I had a fusion, not a minimal invasive surgery, and I actually went home the same day. So let's just keep that in mind. Like I said, a minimal invasive surgery, you're supposed to go home the same day. I didn't, and that's okay. Some people have complications, like in my case, I had that. However, I was able to get around and start moving after the same amount of time it took to do the fusion. The healing is still on your spine. It's still going to take a long time. You're going to have to recover for the same amount of time as if you were also getting a fusion. Yes, that still happens. Another thing to keep in mind, yes, I was able to walk and feel good and I didn't feel pain anymore. It was literally immediately gone. But I still needed physical therapy, just like with any other surgery. In order to retrain your body, just to get right because it was in pain for so long and then you got used to all of these weird positions to accommodate the pain, you still have to go into physical therapy so that you can relearn how to use it and how to use it correctly so you don't re-injure it again. It takes a really long time for the spine to heal. The next thing with the laminectomy is that you still have to go through all the procedures of any other surgery. So there's really no such thing as a mild surgery or a huge surgery. Maybe for the doctor, that is. But when it comes to recovery, when it comes to the time, all that stuff's still the same. You still have the same recovery period of 8 weeks. You still have that same thing, and then after that they'll tell you, hey, make sure you don't do XYZ for the next year or so. And the same thing happens with the fusion. Anytime you do any sort of surgery on your spine, that's what's going to happen. Did it actually fix everything? No. As a matter of fact, removing all of the discs, I would say that if I could have had the decompression and the fusion at the same time, I probably would have opted for it, even though they would have told me that they were two completely different things and my bill would have probably been $500,000 or something like that. If they could clean up the area of the canal and shave off whatever needed to be shaved to provide more space, to clean up everything that was going on the inside, and then say, all right, now we're going to go ahead and do the fusion of fusing your bones here to go ahead and close this up. I would have been really happy with that because after my fusion, I feel a lot more stable and I do feel less pain, even though I'm currently on epidural injections. That's another story for another day. It's not as bad as it used to be, where it feels like something is changing or shifting, I should say. And probably a lot of people don't have that. What happened is that because of the laminectomy, I lost a lot of support of my spine structure underneath, because it no longer had the disc. So everything underneath it also started to fall apart and it was starting to slide forward or have some slippage. In my case, I have congenital spinal stenosis, so I am quite young. Is a laminectomy good? Absolutely, it really is. It does help you get relief when you're able to move and walk around again. I wasn't able to feel my legs. When I walked, I had to sit down every 20 minutes because I lost feeling in my legs. I couldn't feel the floor. I couldn't couldn't feel the surface of the ground. They would tingle, they would go numb, and then they'll be in a crap ton of pain. I would have to sit down to wait until that entire thing is gone, and then I'll be able to get up and start walking again. That was the reason for me having my laminectomy. So I'm not sure what your reason is, but that was the reason why I needed to have the minimally invasive surgery. But as a result of having that minimally invasive surgery, the bottom was no longer supported underneath it, and it resulted in me needing to have a fusion because the spine was slipping forward. I hope that helped you. I hope this was super informative today. And if you like this, please click the like button because, you know, I'm really trying to get this out there, you guys. I'm seeing a lot of stuff out there where people are saying like, hey, that's not right. Hey, I'm 30. Hey, I'm 40. And I'm like, look, I was 29 when it hit me. So I completely understand. You probably have something different like congenital spinal stenosis. And if you do, please check out my video on congenital spinal stenosis where you will be able to see what that's all about and see if that's what you probably have. But I'll see you next time. Bye.